I just want to do a few little reminders about urinary catheters. So remember to empty them when they're full, and then please don't place them on the bed unless you absolutely have to. I know when we're proning our patients, we've been doing that. It makes it a little bit easier, but then immediately put it down below the patient again. Also want to remind you that Cotties, we're extremely diligent about our patients and our cleaning of their peri area to ensure they don't get Cotties, and I wanted to review that process. So cleaning on our unit has changed just recently, and so our nurses even may not be that familiar with it just yet, but we should be cleaning with regular wipes, making sure everything's nice and clean, changing our gloves, using the Provon wipes, changing our gloves again, and using 2 packages of CHG wipes. 1 wipe on the meatus and down the catheter, and then 1 wipe on each thigh, and then we ask that you use the last wipe on their hands. Also a reminder about Cotties, if we suspect an infection and they have not been here for 2 midnights, we want to be fast in getting that culture. If it's been more than 2 midnights, we want to be a little bit slower to do that. We also want to remind you, here in the ICU, we do INOs on our catheters. We measure with the urometer and dump it every 2 hours. So it's not like upstairs where you would just let it drain for the entire shift and then measure it. We're constantly looking at our urine output as a gauge to tell us how that patient's doing. If it's starting to drop off, we're looking at that trend. My blood pressure is probably corresponding with that and dropping. So urine output's a good measure of how the patient's doing hemodynamically. Also, when you're inserting catheters, our policy is 2 people must be present in the room when that process is happening. And then also looking for alternatives. I know you guys are good at doing this. Just a reminder, Shiwis for females, Conencaths for males. Maybe they don't even need something. Maybe they can void on their own, but we want to get those out just as soon as possible. So we do have 2 Foley options, urinary catheter options on our unit. We have a Foley sensing temperature kit and a regular Foley kit. So just make sure you're choosing the correct one. You're completely fine to use the temperature sensing kit, but just look before you open to make sure you have the one that you want.